Have you ever hurt yourself just by sitting down? Not from a fall, not from heavy lifting, just from sitting in a chair. If that sounds ridiculous, I promise you it is not. And if it has happened to you, you already know exactly how real that pain is. That sharp shooting sensation that fires down your leg, the burning, the numbness, the deep ache that starts in your lower back and travels all the way to your foot. Some people feel it the moment they sit, others feel it after 20 minutes at a desk or during a long drive home. Either way, it stops you cold and you start wondering what in the world is going on inside your body. Hi, I'm Dr. Megan Tomberlin at Waves of Wellness Chiropractic in Leland, North Carolina. And what you are feeling has a name. It is called sciatica, and sitting is one of the things that makes it significantly worse. Today I want to explain exactly why that happens, and more importantly, what you can actually do about it. So what is sciatica exactly? The sciatic nerve is the longest nerve in your entire body. It runs from your lower back, through your hips and glutes, and all the way down each leg. When that nerve gets compressed or irritated, it creates that signature shooting pain, numbness, or weakness that so many people describe. And here's something that surprises a lot of people. Sitting is one of the worst things you can do when that nerve is already under pressure. Think about it this way. Imagine a garden hose with water flowing freely through it. Now pinch that hose in the middle. The water slows down, pressure builds up, and nothing flows the way it should. That is exactly what happens to your sciatic nerve when you sit for long periods of time. When you sit, a muscle deep in your glutes called the piriformis gets compressed. The sciatic nerve actually runs right underneath that muscle, and in some people it runs directly through it. When the piriformis tightens up from prolonged sitting, poor posture, or repetitive movement, it squeezes down on that nerve like a clamp. Add in any existing spinal issues like a herniated disc or a misaligned vertebra, and you have got even more pressure building on an already aggravated nerve. That is why so many people feel fine standing or walking, but the moment they sit down, especially for longer periods, the pain flares right back up. Now here is where it gets important. A lot of people try to wait it out. They take some ibuprofen, maybe ice it, and hope it just goes away on its own. And sometimes it does calm down temporarily. But if the underlying cause of that nerve compression is not addressed, the symptoms almost always come back, and they usually come back worse. The nerve does not get better by being repeatedly compressed. It gets more sensitive, more irritated, and the pain cycle becomes harder and harder to break. The good news is that there are real, effective solutions. At Waves of Wellness, we take a thorough approach to finding out exactly what is causing your sciatica and creating a plan to actually fix it. Chiropractic spinal adjustments are often one of the most effective first steps. When the vertebrae in your lumbar spine are misaligned, they create direct pressure on the nerve roots where the sciatic nerve originates. Gentle, targeted adjustments help restore proper alignment, reduce that nerve pressure, and get your spine moving the way it was designed to. We also address the soft tissue component because tight muscles like the piriformis play a huge role in sciatic pain. My colleague, Dr. Jordan, uses a technique called active release technique, or ART, which targets the specific muscles, tendons, and connective tissue that are compressing or pulling on the nerve. It is incredibly effective for releasing that deep muscular tension that spinal adjustments alone cannot always reach. For more advanced nerve compression, spinal decompression therapy is another tool we use. This gentle traction-based treatment creates space between the vertebrae, taking direct pressure off the discs and nerve roots, which allows better circulation and healing to the area. And for patients dealing with chronic muscle tightness or nerve hypersensitivity, I also offer dry needling. This treatment uses thin filiform needles to target trigger points deep in the muscle tissue, releasing tension and calming down an overactive nervous system response. It can be a real game changer for people who have been dealing with sciatic pain for a long time. Every patient we see is different, and that is exactly why we start with a thorough evaluation before recommending any treatment. We want to understand your specific situation, your lifestyle, how long you have been dealing with this, and what is actually driving your symptoms. If you are in the Leland area or anywhere around Wilmington or Brunswick County and you have been living with that shooting leg pain or that nagging ache every time you sit down, please do not keep pushing through it. Your body is telling you something, and the earlier you address it, the easier it is to resolve. Give us a call at 9108-598359 to schedule your first appointment. We are located at 473 Old Waterford Way, Suite 118 in Leland, North Carolina. And you can also learn more about us at wavesofwellnesschiro.com.